Hi, friends. I'm Medic Manny, and welcome back to Learn to Save a Life. I'm a paramedic, CPR instructor, and the guy who's going to help you tell the difference between two of the most commonly confused and deadly heart emergencies: cardiac arrest and heart attack. Yes, they both involve the heart. No, they are not the same thing. And treating them the same, well, that could cost someone their life. Let's start with the one you've probably seen in every movie. Someone dramatically clutches their chest, they become short of breath, and they start to feel impending doom. That's a heart attack, or in fancy medical terms, a myocardial infarction. A heart attack happens when blood flow to part of the heart is blocked, usually by a clot. That part of the heart isn't getting enough oxygen and the muscle starts to die. But here's the key: the heart, it's still beating. It's damaged, yes, but it's still working. The person is usually awake. They might have chest pain, nausea, trouble breathing, or feel really tired. And not everyone has dramatic pain, especially women. Sometimes it's just back pain, fatigue, or a sense that something ain't right. If you see that, call 911 immediately. Let the medics handle it. They may need aspirin, oxygen, or even a procedure to go in and open up that blocked artery. But do not start CPR unless they collapse and stop breathing. So heart attack equals no CPR. Got it? Now let's talk about the other emergency, cardiac arrest. Cardiac arrest is when the heart's electrical system suddenly fails. There's no more heartbeat, there's no blood flowing, no oxygen to the brain. It can happen out of nowhere, sometimes even caused by a heart attack. But when it happens, the person will collapse, be unresponsive, and not be breathing or only gasping. This is when you step in. Call 911, start CPR, and use an AED. Every minute without CPR drops survival by about 10%. So don't wait for someone else. You can be the difference. Now let's break it down side by side. Heart attack, you got a blocked artery. The person is usually awake, needs medical treatment, and no CPR unless they collapse. Now, cardiac arrest, we have electrical failure, person is unconscious, they need CPR and AED immediately. Here's a quick rule of thumb: if they're talking, it's probably a heart attack. If they're not breathing, it's cardiac arrest. Now you know the difference, and knowing means you can act fast, the right way, and maybe even save a life. If you found this helpful, give it a like, hit subscribe, and share it with someone you love. You never know who might need you in an emergency. I'm Medic Manny. I'll see you next time on Learn to Save a Life.